Welcome to the 354th Fighter Wing Live Virtual Coronavirus Town Hall. Today is March 17 and this is our second update to the wing. I am Tech Sergeant Quintanilla here at the Eielson Public Affairs Office, and today with us we have Colonel Benjamin Bishop, the 354th Fighter Wing Commander, here to chat about coronavirus and specific impacts to our airmen, families, and overall Eielson team. We also have with us Lieutenant Colonel Dr. Matthew Ramage, the 354th Medical Group's Chief of Aerospace Medicine. So if you didn't join us the last time, we'll be taking questions in the comment section, so please let us know what's on your minds, and we'll try to get to as many of those while we are live for the next hour. So to start off, a lot has changed over since our last update, sir. I understand there's been a few changes over the weekend. Can you talk a little bit about that?
Absolutely. So first of all, thanks for everyone tuning in to this information. This situation is changing rapidly. And Eielson Air Force Base and our surrounding community is no exception. So I think the first change to really highlight is COVID-19 is here. Many of you may be aware, but last night Fairbanks Memorial Hospital confirmed 2 civilians tested positive for the coronavirus. What we do know at this point is those civilians had recently traveled to the lower 48 and they had been in the community for the last few days, perhaps even weeks. So we'll get more information as the investigation continues, but we'll certainly keep you posted. What that really means for us is this is a real threat. Coronavirus presents a threat to our people, our mission, and our community. But fortunately, there are simple, effective measures that we can take to mitigate this threat. And we'll talk about those measures we can take individually, measures we're taking as a fighter wing, larger community, then also measures we're taking as a larger Department of Defense and also nation. So we'll get through those measures, and there's lots of questions, a lot of confusion, but we'll certainly get that clear guidance out. And again, thank you for joining this venue so we can help make that even more effective.
All right, sir, thank you. So we've all seen in the last couple of weeks or last couple of days the DoD guidance on travel restrictions. Can you talk about how that, or maybe some local restrictions at this time?
Yes, so there have been several issues of DoD guidance restricting travel. First and foremost, travel outside the United States was restricted to Center of Disease Control Level 2 and 3 countries, or CDC Level 2 or 3. So that went out last week, and also over the weekend there was a more restrictive measure that came out from the Department of Defense restricting travel within the continental United States as well. So currently we're kind of just holding fast. We're not moving around. This guidance applies to PCSs. This guidance applies to TDYs. It also applies to leave. In the 354th Fighter Wing, we've stood up measures in order to clearly communicate this guidance to all our active duty members and also their families through formal command directives. And we've issued 4 of those command directives, and we'll be issuing another one here soon to help get this information out. Under those command directives, I have placed a restriction on leave to the local area. That is defined as within 250 miles, and really what we're asking you to do is stay away from populated population centers. For example, we don't want to be going down to Anchorage in this environment. So that's one of the things that we're doing. Regarding TDYs, those again are restricted to mission essential only, and those will be adjudicated up the chain of command. For those that have already traveled or are in through the process of PCS, they'll continue to move through their areas of travel in order to arrive here. And then those that are currently in leave to the continental United States, they can obviously come back here. As we have a lot of people that are traveling, that is one of the other kind of precautionary measures that we're taking in order to protect our mission and our people. So those that are returning or have had travel to those CDC level 2 or 3 countries, or have actually traveled outside the state of Alaska, what we are doing is we are restricting movement for those individuals. Restriction of movement, or ROM, you may see the acronym. It's also referred to quarantine. You can kind of use those interchangeably. But what we're asking those people to do is stay home, social distance, don't have contact with other individuals for 14 days since they traveled outside the state. And what that helps us to do is just to make sure we can kind of stay hunkered down and help prevent the potential spread of the coronavirus. I have directed that for all active duty members and civilians in the 354th Fighter Wing, and I'm encouraging all family members or anyone that may have traveled outside the state of Alaska to do the same while we kind of go through this transition period.
Okay, thank you, sir. I know there's a lot of confusion about maybe at what level, how often are we going to put or send people home in quarantine and isolation, as obviously as precautions are deemed necessary by medical team. But at what point are we accepting risk? And maybe, sir, you can discuss your expectations for us to continue that mission during these times. Yeah,
that's a good question about mission risk. One of the things I do want to highlight up front is, although there's been 2 cases down in Fairbanks community, we have no known cases of coronavirus on the installation at this time. However, we do have 2 cases under isolation that we are looking at. Dr. Ramage, would you like to talk to those?
Yes, and so the term patients under investigation is so anybody who falls within that higher risk definition, so that is somebody who's traveled outside the state of Alaska in the past 14 days, or somebody who has had exposure to a laboratory diagnosed case of COVID, and they have symptoms of cough or fever. If somebody meets that case definition, they require the testing. So once a patient is getting the COVID testing, they're put in what's called isolation. They're symptomatic, and they're being segregated from their family. If they can do it practically in their own house, that is ideal because they have the materials that they would need for that long term, until we get those test results back. Right now, even though the test is run in the local area and the turnaround time is about 4 hours after the test is submitted to the lab, the tests are batched, and so we're getting a daily update. So any tests that are drawn during a day, we will have those results for the next day. So in effect, if you test negative, that's great, but during that period until we have the lab results, out of an abundance of caution and to prevent further spread should that test be positive, we are directing the commanders to place those individuals in isolation.
Thank you, Dr. Ramage. So we're going to take our first break here, and then we're going to ask some questions from our listeners about Eielson specific guidance, and Colonel Bishop will kind of speak to those expectations as well.
Novel coronavirus, what you need to know. The novel coronavirus is a new type of virus that recently started making people sick. It started in mainland China, but is now also infecting people in other countries. Through droplets when an infected person coughs or sneezes. Close personal contact, such as caring for an infected person. Fever, cough, difficulty breathing. What can I do to protect myself and others from respiratory infections like novel coronavirus? Stay home when you are sick. Limit close contact with people who are sick. Wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Clean and disinfect frequently touched objects and surfaces. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. If you do not have a tissue, use your sleeve, not your hands. Use face masks only if you are sick or have been instructed to do so by your healthcare provider. Get a flu shot to prevent influenza if you have not done so this season. Practice good hygiene. Call your doctor or healthcare provider if you develop symptoms and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with widespread or ongoing community spread of COVID-19.
If you have recently arrived in the Fairbanks North Star borough from a high-risk location or airport such as the Seattle-Tacoma Airport, and you are experiencing symptoms of COVID-19, it is highly advised that you self-quarantine for a period of 14 days and call the 354th Medical Group's Public Health Office at 907-377-6678. Refrain from entering the medical group unless instructed to do so. Again, the phone number to 354th Medical Group's Public Health Office is 907-377-6678. Social distancing can help slow the spread of COVID-19 in affected communities. This means avoiding crowded places and maintaining distance from others. For more information and to receive the latest updates about novel coronavirus 2019, visit cdc.gov/COVID-19. That's cdc.gov/COVID-19. Attention all 354th Fighter Wing active duty airmen. The base commander has restricted all non-essential movement to include leave, temporary duty locations, and permanent changes of station. Eielson Air Force Base is currently in Health Protection Condition Alpha and implementing HPCon Bravo measures. Upon arrival to Hersey Gate, present your ID to the 354th Security Forces personnel with the barcode clearly exposed and ready for scanning. Do not depart until instructed to do so. For more information, consult your chain of command and stay up to date by visiting eielson.af.mil/coronavirus/.
And we're back. If you're just joining us, I am Sergeant Quintaniza, and I'm here with Colonel Bishop and Colonel Ramage. And we're here to talk about coronavirus because there are a lot of questions going around, and we want to make sure that the Eielson community is informed with the correct guidance straight from the medical experts and the commander. So, sir, what are we doing differently on base and why?
Well, I think we are doing a lot of things differently in order to properly respond to this situation. I think it's important that we all take an active participation in helping us get through this challenge and really through this threat. And I think the first thing everyone can do is just exercise proper hygiene. So there are some things that you can do or really need to be in your cross-check on a daily basis and really hourly basis. So Dr. Ramage, you want to talk to some of those personal hygiene measures you can take?
Yes, thank you, sir. So really, the containment of this virus and any virus really begins with the individual. And so constantly washing your hands when appropriate. Make sure that you wash your hands before you eat. You wash your hands after you go to the bathroom. You wash your hands after you touch a common touch public surface. The ability to, and I get it, service before self, we all want to be there for our jobs. We all want to be there to do what our mission is, but we need to think about others right now. If you are sick and you're having symptoms, the runny nose, it likely is not COVID. However, to prevent the spread of other normal cough and cold viruses, if you are sick, don't go to work. Separate yourself from others so that you don't get others sick. Some things that we're doing now, luckily it's going through the community. We're doing less of these touch greetings. We're shaking hands less. We're hugging less. We're doing that, the chicken wing COVID elbows. I think that's great, just so we don't spread the virus or any viruses to each other. A big thing that we're recommending now is a wipe in, wipe out campaign. And so when you go to your duty section, like we said last time, most airmen are working at a console or a computer desk for a majority of the day. And so when you start the day, go ahead and wipe down your surfaces, wipe down your cell phone, wipe down your phone, your mouse, and the door handles in your immediate vicinity. Wash your hands frequently throughout the day as appropriate, and at the end of the day, go ahead and hit those common surfaces again, and so we can debulk any virus that may be present, because there is that 7 to 9 day persistence on surfaces.
So in addition to taking precautionary measures as individuals, we're also doing it as an organization, as a team, and as a community. So one of the things, if you're sitting at your desk or you're an airman with email, I've sent out an email just about 20 minutes ago, and really just talked about the changing environment here, how we have COVID in the community, and then just a foot stomp on constant hand washing, constant cleaning of regular touch surfaces, just like the doctor talked about. Don't touch your face. The no handshakes, again, the elbow bump for COVID, for example. And then really social distancing to a minimum of 6 feet between individuals whenever possible. Also, I've issued guidance to the wing that we're not going to have any gatherings of 50 people or more, and then we're going to minimize gatherings in excess of 10 people. Then we also mentioned the restricted movement of quarantine. Again, if you traveled outside the state of Alaska, we need you to quarantine, kind of stay at home for 14 days since that travel. And then again, if you're a military member, that's one of the directives we've sent, and then highly encouraged for everyone else. One of the other things to do is you're going to see an impact on our services around base. For example, FSS is closing down some of their services. Some highlights is our Eielson Community Center. So I have children. I love that Eielson Community Center, but I decided to close that just because trying to sanitize that facility is very difficult. Likewise, we're not going to have any bowling. The bowling center is open for food, but we're not going to do any bowling because I can't really sanitize inside a bowling ball. So those are the kind of the things that you'll see around base. A full listing of those closures can be found on our FSS app, and then we'll also have that posted on our website. Expect some of those will change as the conditions change. Currently, our Baker Fieldhouse is still open. One of the things that's important is to try to maintain good physical health when we can, and we've encouraged members to practice social distancing while in the Baker Fieldhouse and practice good sanitization. So we'll have wipes for you. Don't get on the treadmill next to other people, but we want to provide the environment where you can practice social distancing, but still get a workout around the track, and provide that opportunity. One of the other things that we're looking at is being able to provide movies. We have a large theater. We're going to restrict the numbers, but where you can actually sit and be able to watch a movie separated from other people. We're going to limit the numbers that will attend the movies. And then once the movie is done, our FSS teammates are going to go and sanitize the whole facility in order to be able to do that. So,
thank you for that, sir. Other question or areas of concern? What's happening with AFBs or the commissary?
That's a great question. I have been in contact with the AFB's regional manager and our very own DECA store manager here, and I'm happy to report that they don't have an uninterrupted stream, so we're getting supplies in. However, we are out of some supplies. For example, hand sanitizer. There's just a shortage, and DECA, that is the Department of Defense company that runs the exchange services, are actually prioritizing overseas locations like Italy, where the COVID virus is much more rampant than it is here. So you're going to see some of those supplies short, specifically hand sanitizer. One of the things that we are doing, just as a precautionary measure, is we are implementing some rationing on kind of the basic commodities like milk, eggs, peanut butter, sugar, rice, spaghetti sauce, toilet paper. That's going to be limited to one per family per day. So what we do ask is you just be prudent. Obviously, you want to have supplies for you and your family, but we don't need to go overboard and get a mass quantity of supplies, because that would be to the opportunity cost of other people. So we're being very smart with our commissary in order to make sure that we can ration. And you get one of those needed items every day, and then you can kind of come back the next day if you need more. But I think one of the things that is important for us is just to be very considerate. We're going to get through this. There's going to be challenges, but we're going to come together. We're taking proactive measures. We'll get the information out, and then we'll be able to support each other as a community. And I would ask that you do that as you go into the commissary. Just be mindful of the things you buy, and then also be mindful of wiping down and providing good social distancing and good sanitation procedures in the commissary.
Yes, sir. And just to echo, absolutely. I've seen it myself. There's a shortage in the local area of the hand sanitizer. But just remember, for those out there who are listening, good old-fashioned soap and water, just like your grandma had, that's a good way to go. So you don't necessarily have to have the hand sanitizer to get clean. Just regularly washing your hands. And if you're running out of the Clorox wipes or the Lysol wipes, not recommending a specific brand, they're all functional. In a pinch, you can absolutely do a 1 to 50 dilution of bleach to water in order to spray down surfaces, and that is effective against the virus. So if you have any questions about things that can be used to sanitize, please feel free to visit cdc.gov.
Yes, so just in my own office, Colonel Anger, he brought in his own spray bottle where he had diluted bleach, and we were spraying down our surfaces just as a good technique.
All right, a big takeaway from that is that we're one big community. That's something that I think, in my experience, separates us from just downtown. We here it's a family mentality, and we want to make sure that we're taking care of each other. So hoarding the supplies to the point where your neighbor doesn't have what they need to be safe is just not the Eielson or the Eielson way. So please be a good community member, be a good team member, and use those things and purchase those things prudently and sparingly so that there's enough to go around. There's a question, sir, from Michelle Miranda, kind of touching back on the FSS closures. What does this mean for the CDC?
So what this means for the CDC is we're taking a close look at our CDC to make sure we can offer those services in a manner that's safe for our children, safe for our airmen, and then also safe for our mission. So what I'm happy to report is the CDC, we have very stringent kind of decontamination procedures, if you will, so sanitizing procedures, and we do have that process in place. So unlike the Eielson Community Center, which is very difficult to sanitize, our CDC classrooms are very easy to sanitize, and we have great team members that are trained in order to do that. One of the other things is you may have noticed that we have closed our youth center services, and what we have done is we are using the employees from our youth center to augment our CDCs, and we're also using the space in the youth center as well in order to help kind of social distancing. So at this point, our CDCs remain open, but as I mentioned, this is a situation that closes rapidly, and we'll take the appropriate action regarding the CDC if the situation relegates. Doctor, do you have some thoughts on that?
Well, and just another thing that I'm seeing with my parents that I'm seeing in clinic, there's a lot of anxiety about what to do with their children during the day. So if you have kids home from school, yes, I understand that they're getting stir crazy in the house. Have them feel free to go outside and play with their friends, but again, teach them the principles of social distancing. Try to limit touching between them, and if all possible, because it's getting warm out there, have the kids play outdoors and not congregate indoors to further limit the spread of any viruses from one to another.
Yeah, doctor, when I came home yesterday, actually, Erin wasn't at home. She was out walking with the kids because it was just a beautiful evening. It was a beautiful sunset. So absolutely. The weather has fortunately been really nice, and the forecast looks good. So take that opportunity to kind of get outside, get some fresh air.
Yeah, I think that all of us who have been here, if you've been here a day or so, you all know that our area up here, we're a little bit isolated, and it's actually working in our favor now. So get out and enjoy the Alaskan environment. Its breakup is coming up. Temperatures for us who've been living in interior Alaska, this is pretty warm. So take advantage of that. Go and explore nature, and make the best of this situation. And on that note, we're going to take a short break. Please stay tuned. And we're back. Thank you all for joining us. I am Sergeant Quintanilla here at the Public Affairs Office, and again, I'm here with Colonel Bishop, the 354th Fighter Wing Commander, and Lieutenant Colonel Dr. Matthew Ramage, our resident expert on COVID-19, or at least that's what we're doing. We're making him answer all these questions. So we're going to go into a Q&A segment right now, and gentlemen, feel free to jump in as needed. The first question comes from Stella Cotter. Thank you, Stella, for tuning in. Is this virus sensitive to heat like other strands?
So that's a great question. There's this common belief that, if we can only get to spring, the sun is going to kill us off. Yes, kind of. And so there's a little bit of an association here. Typically, we see these cold and flu viruses, coronavirus, to be very similar to crop up during the wintertime, the cold months, because that's when people are typically cloistered indoors and in small, non-socially distanced groups. And so when the sun is shining and everything is beautiful and everything is melting, folks will go outside and just naturally distance themselves because they're tired of being next to anybody else like they were the entire winter. But let's be clear, the MERS coronavirus, which is a cousin to this type of coronavirus, survives in our desert nations like Saudi Arabia, which are consistently in excess of 110, 115 degrees. And so really, yes, it is sensitive to heat in that fire can kill pretty much anything.
For anyone who's been deployed, that heat, no one wants to be in it, and neither does the virus. So, all right, thank you for that, sir. Next question is, what about airmen who live off base in a roommate situation where only one is quarantined and the other one is being told to go to work?
Well, that's a great question because it is near and dear to my heart. Let me tell a little Dr. Ramage story. So my wife and son just got back from a wonderful field trip with Ben Eielson to Germany, and lo and behold, Germany and all of Europe became level 3 CDC nations. Well, next thing I know, half my family is quarantined, but I'm still needing to go to work to help keep the base healthy. So as long as your family members or your roommates are quarantined, that is not a problem. However, just maintain that social distancing within your living quarters as much as practical. Personally, I am doing a very consistent surface wipe down. I'm limiting my sitting to one area of the living room separate than the breathing spaces of my other family. So as long as you're doing good practical cleaning routines, washing your hands, having them wash their hands and cover their cough if that is the case, there shouldn't be any major concern. Now, that will change if somebody in your living arrangement does later come down as diagnosed with COVID-19, then everybody in that area with exposure will be later quarantined. Does that answer your question?
It does, sir. Thank you.
Yeah, so just one thing for our listeners, and if you would help spread this message, if you find yourself in a situation where you are sharing a residence with somebody who's under quarantine and you can't have that proper distance, for example, maybe you live in the dorms and share a bathroom, then please, if you haven't done so already, please engage with your chain of command. And commanders, we are engaged on this, and we will provide the environment and the resources where we can have people that are quarantined to be able to provide that space. Ideally, it would be in your own residence where you can be a little more comfortable than in a lodging room. But that is one of the things that your command team will certainly be engaged and will help. So help us spread that. Likewise, if you're in a situation where maybe somebody who is at high risk, so somebody that's upper in age is in that situation, please pass that up to your chain of command so we can take the appropriate precautions.
All right, thank you. Dr. Ramage, I know that we keep throwing the words quarantine and isolation and social distancing out there. Can you please just clarify finally what are the three things, and maybe what is the difference between quarantine and isolation specifically?
Absolutely. So we'll start off with social distancing. Social distancing is just a general term for a large personal space bubble. Luckily, with coronavirus, right now it is believed to be a droplet transmission, and so droplets typically don't carry in the spit particles for more than about 6 feet. And so as long as you have a 6-foot separation from somebody, that's perfect social distancing. You're limiting your exposure to others, you're not touching common surfaces, or you're minimizing that touch of common surfaces. Now, when we talk to quarantine, that is if somebody has an exposure or a potential exposure to an area where the virus is, then they put themselves segregated from the rest of society in an area where they can sit for what we call an incubation period. In a range between 1 day and 14 days after exposure to coronavirus, if folks are going to have symptoms, it will happen statistically within that first 14 days. A large portion of those are happening within that 5 to 6 day window. So quarantine lasts throughout the period of incubation, which one would expect to become positive and have symptoms from coronavirus if that exposure was true. Now, isolation, there's a subtle difference here. Isolation is somebody who has a known exposure, i.e. they're in quarantine, and they have symptoms or are later diagnosed with the disease. So with the 2 patients under investigation that we discussed earlier at Eielson, we have 2 individuals waiting that day for the lab results to come back. So we are presuming that they're positive until we have proof that they are not. So they're isolated, further segregated, and absolutely limiting any contact with any other individuals in the living area. Now, if they're diagnosed with COVID, they will stay in isolation until they're, and this is an evolving target based on what CDC recommendations are, but right now, until they are 48 hours symptom-free and there's 2 negative tests separated by a day before they can be released from isolation to make sure that they're no longer shedding these virus particles.
Thank you for that information, sir. So you're telling me that all these years of being an introvert is finally going to fall into my favor, huh?
That's right. It's the big show.
All right. We're going to go to our next question. Dr. Ramage, you're up again. What is the capabilities of the clinic as far as testing?
That's a great question. So if you've been to the clinic during this week, you've noticed some significant changes. And so we're asking all people who are coming to the clinic for services enter through the main clinic entrance. There you'll be greeted by our desk guides, and they will ask you a series of questions. And so if you've had travel outside the state of Alaska in the past 14 days or have had exposure to somebody laboratory diagnosed with COVID, not exposure to somebody who's been quarantined, but have exposure to somebody who is laboratory diagnosed COVID, and you're having symptoms, so the fever, temperature of 100.4 or greater, or cough, or any runny nose, cold symptoms. If you screen positive with that, you'll be asked to follow the orange brick road. We have some flags guiding you around the side of the clinic to our special COVID clinic. At that point, you will be evaluated, and if you meet the clinical testing criteria, which is ever changing, then you will be given the COVID-19 test and placed into isolation. So I want to reiterate, if you're having symptoms and you're currently in a quarantine group, the recommendation is to come to the clinic. You'll screen positive from our desk guides and go to the COVID clinic where it will be tested if indicated. But then you do run the risk of being placed further into isolation. If you screen negative, if you have cold symptoms but you have no known exposure to somebody diagnosed with COVID or no travel history within the past 14 days, you'll be admitted into the main clinic area and you'll be treated as you would on any normal day.
Thank you for clarifying that, sir. We have another question from Amber Morley. Thank you, Amber, for submitting this question. What is the plan going forward when it comes to visitors coming to Eielson?
Okay, regarding visitors coming to Eielson, first of all, I just want to reiterate our first precautionary measures is control what you can control. You can control your own personal hygiene. You can control your personal space. So that's the first thing that we have regarding our plan, and we're moving out on that. As far as the travelers coming to Eielson through DoD travel, that is going to be almost coming to a halt. So we're not doing any TDY travel up here. I don't foresee any large exercises in the near future. For example, our Red Flag Alaska that was scheduled for May has been canceled. We still do have 3 other Red Flag Alaskas scheduled for calendar year 20. We're still moving forward with planning, but for the near term, we're not doing any large exercises. So we're reducing the number of travelers and the number of official travel that comes in and out of Eielson. I will say we do have a lot of people that travel in through the gate from the local community because we are part of the local community. So that's one of the things that we are emphasizing is we all need to take a very active part in the precautionary measures. Again, if you're active duty and you've been traveling outside of 14 days, please just stay home under quarantine like the doctor was talking about. And then I highly encourage anyone else in that situation to do that as well. That's the best thing we can do to help protect it. Doc?
And sir, one thing to tag on, I've noticed in ever increasing numbers, there are folks who are not having any symptoms but are currently quarantined that are coming to the clinic and looking into testing. Right now, that is not the recommendation. You are quarantined. Please, please, please stay home, separate yourselves from others. If you're not having symptoms, good news. You don't have anything to worry about at the moment. And aside from a very limited evidence, most virus will only be able to be tested for once you're having symptoms. That coincides with when that viral load, we call it in medicine, gets high enough to the point that it will come positive on a test. So if you're not having any symptoms, please stay at home.
Doctor, if you're not having any symptoms, can you still spread the coronavirus?
It is possible. But that's why we're doing this social distancing, to keep folks away. So it's not recommended to come in to get testing, because if you have a negative test while you're in quarantine, while that may be reassuring, that doesn't rule out the fact that you're a carrier.
Okay. So if you're in that quarantine situation, and some of you may be a little stir crazy, if you will, staying inside, one of the things that I do encourage you to do is stay connected to your family, stay connected to your friends, stay connected to your leadership, to your squadron leadership, especially if you're a member of the Air Force. And then also if you're a family member, obviously there's support through the command networks as well. So again, it's important for us to respect these guidelines, respect these directives in order to safeguard the community and help us move forward.
All right, we have a follow-up question from Stella Cotter. If contractors become symptomatic while at work, do we get tested at the clinic or go to the ER?
Okay, so if a contractor becomes symptomatic while at work, so right there in the subtlety of this question, presuming that a contractor is at work, I would hope they would not have fallen into that recommended quarantine category. And so luckily, there's really no need for testing in somebody who's getting symptomatic at work right now, because currently there's no community spread evident on Eielson Air Force Base or in the Fairbanks area. So most likely that situation represents a normal cold. Please don't come to work. If you're sick, stay home, and that's going to reduce a lot of the confusion because we're having two very similar entities, the cold and then COVID. If we can eliminate one as a variable, then that's going to make it a little more streamlined for the medical professionals.
Okay, so you're saying basically the exposure to the virus while at work, presumably because we've already implemented these measures, is it's more likely to be a common cold or a common flu. That said, Colonel Bishop, should they just route this up to the chain of command? Hey, this is a member, this is their circumstances, and their commander or anyone else in their chain of command can make that decision?
Yeah, absolutely. So there's a lot of nuance and subtleties in this question. So this is one you need to get your chain of command engaged in ASAP, because that is the best way in order to make sure we are taking the proper precautions in this specific situation.
Understood. All right, we have another question. Do you foresee the base going to mission essential personnel only?
I see the base taking the necessary measures in order to protect our airmen and their families. That's really my first priority. My next priority is ensure and preserve the mission, and then also support the community as a whole. So if based on the situation that we're in, which we all know changes very quickly, we see a need for mission essential personnel only, then I will certainly make that decision and communicate it through formal channels, and we'll get the word out. So again, what I want to keep coming back to is reiterate, basic hygiene is the best thing we can do. Please include the social distancing. Those are the things that we're going to best help take care of our airmen and our families, best preserve our mission, and support our community as a whole.
All right, last question before we take another break, and it's about the clinic services offered right now. Obviously, we know that COVID-19 is at the top of a lot of priority lists, but that doesn't mean that other parts of the clinic, or that patients can't go and be seen at other parts of the clinic. Is that correct?
Absolutely. And so as long as you're coming through the front desk of the clinic where our desk guides are sitting, as long as you can enter that way and have not screened positive with any exposure to a known COVID patient or travel in the past 14 days, the clinic is open now. Of course, as you alluded to with the bandwidth that is being taken up by COVID-19 preparation, we are highly encouraging folks for any of the well child checks, aside from the in the first 2 months of life, because those checks need to be happening fairly frequently in the early stages. Any well child checks, any normal physicals. We're exploring limiting fly PHAs and any of the in-person PHAs, because we don't want to have a situation where we're congregating individuals who are ill and mixing that with a healthy population, because that's the one way we can just take down our operational capability. We still have all of the clinic facilities open, but we are not doing any elective procedures. One of those to be included would be vasectomies. That is an unnecessary risk and would take up valuable resources at this time. So we're gonna put it on the back end for when we're past this coronavirus.
I think that we can all get on board with that. And so we're going to take a break. Again, thank you guys for tuning in. We'll be right back. And we're back. Thank you all for joining us. Again, I am Tech Sergeant Quintanilla at the Eielson Public Affairs team, and I have Colonel Bishop and Lieutenant Colonel Dr. Ramage here talking about coronavirus and how it affects the Eielson community and team. We're going to roll right into this question, which I think everyone is wondering right now. Sir, gentlemen, if I or my family are placed in isolation, what happens then?
Yes, and so if you're in isolation, it means that you have met that exposure criteria and you're having symptoms and are being tested. So once you're in isolation, you're going to be segregated, and then a member of the medical team will be contacting you daily to see how that you're doing until either your test comes back negative or you recover from coronavirus and have the successive tests that were negative as well.
The only thing I'll add from my perspective is even though you're in isolation and you're separated, you're still connected to our community. So please be proactive in connecting with your friends and family through virtual means, and expect your supervisor and command channel to be connected. So if you have needs while you're in isolation, we're still there for you, and we'll make sure that you get the support you need in order to get through that situation.
Again, just reiterating what the boss says, this is a team. We are a relatively small base, which in this situation can be good and also bad because we're all interacting and very closely associated with each other. And in this time, practicing social distance might be a challenge, and it might not even be your default, but for the sake of everyone's health and safety, please do so. And for those people who are in isolation or quarantine, please mental health is a big priority for us. We want to make sure that you guys are not just closing yourself off to everything. You can't be around people, but now's the time to engage with your family and your friends through whatever virtual means you have. And also look to your team members, whether it's a phone call or if they're delivering food or something for you. Take advantage of those opportunities. Resiliency is a very big priority. I know Colonel Bishop, you're right here. You can speak to it. He's nodding his head. And in this time, even in the middle of coronavirus, we want to make sure that the team is resilient. We want to make sure that we're taking care of ourselves and of each other. And sir, if you want to speak more about how you feel about that.
Certainly. So resiliency is part of our DNA as airmen and frankly as Americans, but especially as American airmen in Alaska. So we are on the Alaskan frontier, and we are used to being able to deal with adversity, and coronavirus is no exception to that. So one of the things that I do want us to think about is we're very fixated on the threat of coronavirus, and we're taking proactive measures, and we're all going to participate in doing that. But also, as we're doing those, let's not forget we still need to be there for each other. We still need to be connected. We've had resiliency days. We just had one recently where we connected as small groups. I think if you all know my message is that's an important part of readiness, and that is something we're going to continue to do. So even though we can't connect with close physical contact and handshakes and high fives, we're still going to connect with those virtual handshakes, with virtual high fives, and be able to support and connect each other. Likewise, if you're feeling down, if you're anxious, if you're concerned, that's normal. That's just part of being human especially when there's a lot of uncertainty in the environment. So if you have those feelings, don't suppress them. I encourage you to connect with each other, connect with your wingmen, connect with your leadership, connect with your subordinates, connect with your family, connect with somebody that you might know in Italy right now. One of the things that we can do is really get external and think through Italy that's under lockdown right now. They're in a very different environment than we're in. So connect and provide some support. Try to get external. And that's what I do when I start feeling down. I have a good friend of mine who's the vice wing commander at Aviano right now, and we've been texting back and forth. And I said, hey, brother, I'm thinking about you. You guys have a great team, and we've been able to have that virtual connection. So as you look at resiliency, as you look at this challenge and this adversity, please keep that in your cross-check. I will say we're about ready to go through breakup. And just historically in breakup, that's where we see a lot of mental stress and a lot of anxiety manifests itself. So just keep that in your cross-check is my advice.
Absolutely, Colonel Bishop. Getting through this adverse event is a team sport. We just need to be there for each other and stay open.
Okay, so obviously the command message about resiliency stays the same. We've always had the standing order to take care of each other, to take care of our airmen and our families, and that doesn't change with the situation that we're going through right now. Before we break, any parting words, any last thoughts from either of you?
So just some final thoughts. I alluded to them earlier, but as I look at this situation, as I look at this environment, and then really coronavirus as a threat to our people, to our families, to our community, and also to our mission, my priorities, remain steadfast. First and foremost, we're going to take care of our airmen and their families. We're going to take proactive measures to do that, then also preserve our mission capability. We're going to continue to get after mission where we can in alignment with those priorities. And then last but definitely not least, we're going to support our local community as we move forward. One of the things I would like to kind of close in thinking is, as Eielson, again, we take pride in thriving as a community in the harshest environments. We look after our own, and this COVID-19 pandemic is no exception. So by participating in these active precautionary measures, we'll be able to overcome this threat and continue to thrive as a team here at Eielson. And I'm proud, really proud to be part of that team.
Thank you, sir. Dr. Ramage?
Now, as a clarification, I'm sure that y'all may have seen the recommendation from our Commander-in-Chief and his COVID response team of limiting folks to groups of 10 or more. there's nothing specifically magic about a small group like that. We still, even if we're in a smaller group, maintain the social distancing and hygiene principles that we've been talking about here. And please, please, please wash your hands and don't lick doorknobs.
Now, before we sign off, we just want to make sure that you all have the right information. So, obviously, cdc.gov has the most up-to-date health and hygiene guidance, as well as travel alerts. DoD policy for guidance specific to military members and families are also accessible on af.mil. The Eielson webpage, so it's www.eielson.af.mil/coronavirus. Again, that's www.eielson.af.mil/coronavirus. That is where you can find information specifically from Colonel Bishop here. How you and your families are going to operate day to day, and the expectations put forth is also how the teams the mission doesn't stop. We're going to keep on going, and there's clear guidance and directives coming straight from him. So please use those resources. If we didn't get to your questions, please continue to submit them. We will get to them as we can, and make sure that the information is getting out to you guys. Again, thank you guys. Thank you, Colonel Bishop. Thank you, Colonel Ramage, for joining us and for sending out the good word. We appreciate your time, and we are out.